What's good? What's good? Got the whiteboard out again today. I got that one spliff a day playing in the background. Let me turn that off for you. Great tunes, great tunes. Not bad tunes. Not bad at all tunes. Alright, I'm coming to you. Still in the midst of this COVID era for some reason. We're in lockdowns. But that's why we're gonna start with the healthcare network here. I got this little diagram posted up. Day 2. I might be posting frequently here. This is my second day in a row posting a video here. Yesterday I got 0 views. Hear that? 0 views, and that's not good. But I think the algorithm will pick it up a little bit. Since I stopped putting MGTOW in the titles of my videos, no impressions. My last video got 1 impression. 1 impression. 1 impression. As opposed to the MGTOW video I posted a couple days before that, that's up to like 50 impressions now. Like 50. And that's just sad times, because I think this is more interesting. But it is what it is. Let's see if this gets some stuff eventually. Just erase a little bit of that on accident. But my video yesterday, I talked about basically what I thought was the largest blue ocean. We'll say that the largest blue ocean that is currently facing mankind. I don't want to over dramatize it, but it's just a large blue ocean that's facing people just because it's so new and people are just now starting to take their data seriously. Because they're realizing, hey, companies have been making billions, if not trillions of dollars off of our own data by selling it to governments, advertising companies, analytics companies. You know how many just purely analytics, because I'm studying comp sci now, you know how many just purely analytics companies there are now? Like, data science is a huge thing now. I got a buddy that's a data scientist, and he's cool as, like, he was about to be a dentist, right? But he switched to data science, and I think, he probably made the, truth be told, I met him when I was in pharmacy school. He should have been a pharmacist, the way, like, we were studying them drugs, but, he ended up being a data scientist, which actually might even be better, because, like, now we're, like, linking up a little bit, but I just say that to say this, that data science is a huge thing, and that kind of analytics job, that wasn't as common. They were usually they'd get like math people and things like that back in the day to do some kind of like company analytics things, and it wasn't even considered that big. They still wanted their marketers and all of that. That was thought of as more important. But now just mining all this data that's being collected is just huge right now. And we could disrupt that. Not really disrupt it, but we could just get you as a user a profit off of it. And that's like kind of my plan here. But I'm starting off with the healthcare network though, because my whole thing, I just literally started learning about tech like 1.5 years ago. And the only reason I really did was because I was like, wait, healthcare sucks. Because I was in pharmacy school. And I was like, this blows. If this is how we treat sick people in this country, then that's just not good. Like, I don't even want to extrapolate on that anymore than just to say that that's not good. And just considering the times we're living in now, and if you look around I don't forget what percentage of Americans are like overweight or obese, but let me just tell you that healthcare could use some work here, could use some work to say the least. And we can get into that in other videos, but like we're talking about technology here mostly, so I'll save that stuff for a little bit later. But okay, so starting off with the healthcare network, that will probably be a blockchain decentralized network. Just because that's the new technology and that's super cool to me. Like once I started learning about technology, I had actually my buddy from pharmacy school turned me on to blockchain, and at first I was like, this is not, I didn't think it was like stupid, but I was like, this isn't something that even seems like it would even be a good thing. I was like, this probably won't even be a good thing. But the more I started studying it, the more I was like, this might be a good thing. And then on top of it, I was like, this actually is pretty interesting. So let me just go over this diagram here. So we have the patient, like, so now I'm talking about healthcare as it stands now. You have everybody's in a box, right? In the entire healthcare system, you have all entities are in their own box, and no box talks to the other box, really. They kind of do, but they talk to the other box through a bunch of regulations and things that are pretty uncomfortable to get through. And I think that's the point. I think the point is it for it to be really uncomfortable, so each box doesn't really know what the other box is doing, but then they get the bills at the end of the day and they're like, oh wait, these are the bills at the end of the day. And then life just moves on, and these are the bills at the end of the day. Oftentimes the patients get screwed and life just moves on, and those are the bills at the end of the day. So you have the patients in their box, and that's just cut off from everything else. The patients, everything they're just like on their own, in their own little column here. Don't ignore the I don't know if you can see that, but ignore the blockchain part for now. I'll get into that last. So you notice how that's not in a box. But you have the patients in their own box, in their own column. Then you have pharmaceutical corporations, aka Big Pharma. You probably heard the term Big Pharma, and you probably have heard them in the news a lot, coming out with all of these vaccines that, you know, may or may not work, but that's another story for another day. But pharmaceutical corporations, pharmacy benefits management, so PBMs, you might have heard that term before. And then insurance companies, I'm sure you heard that before. Insurance, you have them in their own boxes, but they kind of talk to each other, like they interact more with each other, but they're still in their own boxes. But they're kind of in the same category, so I put them in the same column. And then you have, that's that column. You have the last column, which is your hospitals, your pharmacies, your clinics, and your private practices. So that could be like, you know, your doctors in private practice, your chiropractors, basically any like medical professional with a private practice. And these people is where the actual care happens, whatever you want to call it. They interact with the patients in terms of, that's their work. Their work is to like care for the patient. And you know, I didn't put schools in here. I could have easily put like medical schools, pharmacy schools, etc. in here, but I didn't. That's actually a big part of it. I probably should have put that in there. And that probably would have, I don't even know which column that would have went in. Maybe I might have put it in the last column here too, or I might have put it in the middle column. But yeah, so you have that column and these people, which as a patient or a consumer of like healthcare or whatever, you're probably familiar with these guys. Like this is where you pick up your drugs, get your treatment, get prescribed your drugs, and you know you might even have like a family friend like that's a doctor that you unfortunately might see too often, depending on the state of your health. But yeah, so that's kind of how this system is set up now. Everybody's in a box. Boxes don't really talk to each other, but they're around each other in terms of whatever column they might be a part of. And the patients are basically all alone and usually left like footing the bills and stuff like that. So now enter blockchain technology. Now you can acknowledge that this is written here. Blockchain technology is kind of what I'm hoping will break through these columns and allow the entire ecosystem to be able to like be more transparent for patients and even for some of the people here, because like the patients aren't the only ones who kind of want transparency here. A lot of especially private practices, but a lot of physicians and hospitals, you know, I don't know about your pharmacy. I was in pharmacy school. I don't know how many people really cared for the transparency, but that's another story. I wasn't in med school, so I don't know about the doctors, but I know there are some healthcare providers, maybe later in their careers, because I was dealing with people who didn't even start their careers yet, so like they can't really put that on them. But just from what I've like seen and talked to some older providers, I think a lot of people would love there to be more transparency, but then they realize that, you know, there's regulations in the way. But that's where the disruptive technologies come in, because I'm hoping the blockchain could be, and this is going to be the hard part, right? Adopted. I'm hoping it can be adopted by patients first, and then the patients, just because they have access to that technology, and by law, if you look at HIPAA, they should have, the patients are supposed to have authority over their own data because it's the Health Insurance Portability Act or something like that. Like it's portability. So the patients are supposed to have access to their own data, and all of these entities are supposed to respect that the patient has say over what happens with their data. So that is already in place, yet no one really, like we all learn about HIPAA. If you're a healthcare provider, you know you probably had to like take these little computer courses on like computer trainings on HIPAA. But that's all that really is done with it. It's just most people take those computer trainings and then they just attempt to not do privacy violations, and it only really matters when there's like a breach of some sort, which, even though it might happen, usually, like, it's not really, unless it's a big breach, then that's when people care. Or whenever like another law was broken, then people go and trace back the HIPAA violations or something like that. But if we can just say, hey, the patient has control of their own data first, just acknowledge that as a fact, we can put their data on a blockchain, encrypt it, and give them the private key to it, and then the patient can share that data by giving whoever they want a public key. So if that's like their doctor, probably they want that, their pharmacist, their like, I don't know, dentist or whatever, they can give the private key, they can give the public key to whoever they want to have their data. And then that person can then like interact with their data, change their data. Like the patient can say, okay, I want this person to like just read my data or or write to the data to use like technical terms. Yeah, and then because the patient has access to their data first, and if they adopt it first, then it's only a matter of time before these columns are broken and each box has to talk to the other boxes, because all of this is supposed to be serving the patient. But right now, all of these people, because everybody's in their own box, they can just serve themselves, and they can kind of like silo their own, they can basically silo the data, right? Because each of these entities has their own sets of data, and that may have to do with the patient or may not really have to do with the patient. Sometimes it just has to do with like the metadata of like the drugs that patients happen to be taking, but this specific patient doesn't matter as much. Like usually that's in this column. But if you can, but if everything was just interoperable, so people would know how efficacious the drug is, that could be part of the data. What health conditions it's actually supposed to be treating, because a lot of times patients don't even know the name of their drug. For one thing, like that shocked me when I was in pharmacy school. A lot of times patients don't even know the name of their drug. They just take the drug. They don't even know what condition that specific drug is supposed to treat, especially if they have multiple conditions. They're just like, oh, I take this for like my head or something, and I'm like, oh no, that's a blood pressure medication, which you could argue it could be taken for your head, but it's a different story. Yeah, so if there's just more transparency, that would be a good thing. My whole thing isn't even, this is just how I want to start it. My whole thing is the preventative measures. I want to basically make this more of a preventative thing, to where patients not only have access to their healthcare data, but like they can create their own healthcare data in the form of preventative care measures. And that just means living a healthy lifestyle, because the goal of my network is to just help people on average live a healthy lifestyle, and then have all of these people, or even like whatever company wants it, to basically buy that data from the patient. So I want the patient to be kind of living good, and then they can just like capitalize off of living good. So they can just say, hey, I'm like eating a good breakfast. Here's the data, like how many calories. Or even if they're sick, they can say, hey, I did this or that. I'm taking this drug, and here's how it worked. And that's data. Like there's so much data, there's so much data being generated that I almost don't know. There's so many different ways that different types of data you could have on a network like this. So I don't want to say per se what the data will be. I just want to kind of show you how, I kind of just wanted to show you how everything was boxed in, and how if you had the patients, if they could adopt blockchain, or it will probably be blockchain because that's just the cool new technology that I'm learning about. If they could adopt something like that, it could break apart these boxes, and then once these boxes are broken apart, there's a lot of different possibilities that could come out of that. Yeah. That's pretty much it. Hopefully that wasn't too long. Yeah, I guess that's the video for today. Now that I'm breaking apart these videos, yeah, I don't have to say too much in one, but yeah, to start with the healthcare network, that's kind of my idea. Yeah. I'm trying to think about what else to say, but I guess that's pretty much it. Decentralized healthcare, you could call it that. Play some soccer, stay healthy. Alright, I guess I'll catch you later.